Hi there, my name is Rebecca Sadun and I'm an adult and pediatric rheumatologist at Duke, and I am delighted to be able to talk to you today a little bit about immunology and how to keep yourself safe in the setting of COVID-19. Just by way of a quick outline, I wanted to start by talking a little bit about who's most at risk, and we'll talk about lupus as a risk factor as well as other risk factors. We'll talk about risks associated with lupus medications, which I know is of the utmost concern to most patients. We'll talk about how to reduce your risks, things that are less risky activities and more risky activities, mask types, vitamins, and other things that can be helpful. We'll talk a little bit about symptoms, what to do if you develop them, testing and vaccines. And then I'll tell you a little bit about a study called Identify Lupus, where we're trying to better understand the impact of the pandemic on lupus patients. I also want to talk to you about how to protect your mental health, which is especially important during this difficult pandemic time. And then I wish there was an opportunity to really delve into questions, but some people have pre-submitted questions, and I will certainly make sure that I'm answering those throughout this talk. All right, so let's begin with who is most at risk. So what are the risk factors for having a severe COVID-19 infection? The sort where you wind up having to go to the hospital, or you have respiratory failure, or at risk for death. Well, we know that the rate of hospitalization, which is a marker for severe infection, increases with age. And the biggest increase sort of starts to uptick around age 50 and then becomes more substantial for patients who are over age 65. We also know that race and ethnicity can play a role, and it's unclear if this is a biological difference or if these are socioeconomic differences or social determinants of health. But what we have seen is in the first column, if you look at Native Americans, the second column is Asian Americans, the third column is Black or African American patients, and then the fourth is Hispanic or Latinx patients in the United States. So all this is United States data. In the first row here, we see the number of cases, since you can see that certain ethnicities are at higher risk for developing COVID-19. The next column is the risk of hospitalization. Again, this is a suggestion of severe respiratory illness. So 5 times higher in Native Americans, 4.7 times higher in African Americans, and 4.6 times higher in the Latinx population. And then the risk of death, so 1.5 times higher in Native Americans, 2.1 times higher in Black Americans, and 1.1 times higher in Latinx Americans, all compared to a non-Hispanic Caucasian population. So all important things to take into consideration when you're thinking about your potential risks. And then there are the common chronic illnesses, and a lot of data has shown that chronic conditions like asthma, high blood pressure, being overweight, having diabetes, or having kidney disease put you at risk for more significant COVID-19. And then if you have 2 of those conditions together, or 3 or more of those conditions, that further increases the risk. These are the really common conditions that are listed in this particular table that comes from the CDC, and I'll talk a little bit more about lupus. The risk for lupus has been found to be about twice what is found for a rheumatoid arthritis patient. What we don't have a really clear picture is what's the relationship between a rheumatoid arthritis patient and a completely healthy patient. But we do know that these risks are additive, so you can have multiple risk factors that make your risk potentially even higher. Okay, so what about rheumatology patients? We found the same thing applies to rheumatology patients as seen in the general healthy public. High blood pressure, heart disease, lung disease, and diabetes are all relevant for rheumatology patients and all increase the risk of severe disease. And then thinking about lupus in particular, we've had one paper that came out that really looked at this and again found twice the risk of hospitalization for lupus patients compared to rheumatoid arthritis patients. When they looked at the medications, there was no risk and no benefit associated with Plaquenil, also known as hydroxychloroquine or its cousins, chloroquine. I know there was some very early hope that perhaps it was going to help be protective. At this time, we don't think it helps, but we also don't think that it hurts. So if you should be on it for other reasons, which most lupus patients should be, please continue on that. Most of the immunosuppressing medications, whether we're talking about methotrexate or azathioprine Imuran or mycophenolate like cellceptor-myfortic, don't seem to have a significant impact on severe disease. While they can suppress your immune system some, the thought is that that maybe is counterbalanced by the phenomenon of patients actually getting super sick from COVID due to the immune system being revved up. So now you have a medication that may dampen your immune system, and it may actually in the end be somewhat protective. So therefore, we consider these medications to be pretty safe in COVID. If you were to develop COVID, we certainly might suggest stopping them, but we would not suggest stopping them out of a fear of COVID, out of a risk of potentially becoming infected. And then there are some biologics that actually seem to lessen the risk for severe disease. So we know that the TNF inhibitors, like infliximab or Remicade, adalimumab, Humira, etanercept, Enbrel, all of the medications in that class seem to decrease a patient's risk for having severe disease. People have more mild disease when on them. And again, that may be because it is a helpful reduction in immune inflammatory response in the setting of infection. The one medication for which we do see an increase in risk is prednisone. And this has to do with the amount that you're on and the length of treatment. So if you're on prednisone for a week, we don't think that that has a significant impact. Where we see the increased risk for severe disease in COVID is if you're on chronic prednisone, particularly chronic prednisone of higher than 10 milligrams per day. Now, I do want to acknowledge that there are absolutely some cases in lupus where that may be required. And we acknowledge that it may increase somewhat the risk of COVID, but it's necessary, for example, to save a person's kidney. If somebody is having significant lupus inflammation of the brain, if they're having active lupus nephritis of the kidney, if they're having major severe manifestations, despite this increase in risk, it may be absolutely necessary. The benefits may outweigh the risks. That said, if you're not having one of those severe manifestations, if it's being used perhaps more for rash or more for arthritis, it is definitely worth talking to your rheumatologist about whether there are some alternatives. I never recommend stopping prednisone suddenly or dropping your dose suddenly. If you've been on high doses of prednisone long term, it can sort of shut down the adrenal glands. You're not making your own steroids that the body needs to operate. And if you were to stop suddenly or decrease suddenly, it can be actually extremely dangerous, potentially even life-threatening. But if you do acknowledge that you maybe are on more prednisone than you think is healthy or safe, talk to your rheumatologist. There may be other medications that they can put you on to help gradually take you off of the prednisone and decrease your overall chances of having either severe COVID-19 infection or really other infections. Okay, so what can you do to avoid getting infected? I think this is probably number one on everybody's list. Let's just avoid it in the first place, because once you have COVID, there's very little you can do to protect yourself from having a severe case. But if you can protect yourself from getting it at all the better. So this is, of course, a sign that's being made by the North Carolina Department of Health and Human Services. It talks about the 3 W's. So you don't need to worry about this, of course, in the safety of your own home or your own yard. But if you're going to be going out into the world where you're going to interact with other people, then you want to focus on the 3 W's. So wearing a mask anytime you might be anywhere within contact of other people, waiting, so trying to stay 6 feet apart, and then washing your hands often or sanitizer if you don't have access to soap and water. And the goal, of course, is not use one of the 3 W's, but using all 3 of the W's as much as possible. Your risk is lowest if you are 6 feet away and wearing a mask and the other person is wearing a mask. That is absolutely the best case scenario. Now, if you are walking along a sidewalk and you cross paths with somebody and you think it was 5 feet, I suggest don't panic, even if you or they were not wearing a mask. The good news is that you were in contact with one another, that moment of passing one another for a split second. And so your exposure is still extremely small, especially given that it was outside. The bigger risk is if people were 5.5 feet away eating lunch together at the opposite sides of a table for an hour, chatting with their masks off. That's where we see a risk of infection, is that prolonged contact outside or 10 minutes or more inside. But just walking across the sidewalk, don't let that keep you up at night. Okay, knowing the risks. So in your head, think about which of these might be the riskiest activity. So option number one is getting takeout from a local restaurant. Option two, eating at a restaurant, so indoors, inside of the restaurant. Option three, having an outdoor socially distanced dinner with a family, one family, so they're all within contact of each other. And number four, having drinks with one friend at a bar. Give it a moment, take a think about what you think is the most dangerous. Commit to an answer for me. All right. If you picked having drinks with a friend at a bar, in a bar, you are correct. And the rationale for that, so bars are considered to be super spreader locations, and that's because people are often closely packed together and they tend to be loud. So people are having to shout to talk to one another, and that shouting causes small droplets to spray, kind of like little bits of spit as we talk to one another. So bars tend to be one of the highest risk environments, and even if it's just one friend that you're there with, there's the likelihood of potentially aerosolization from other people shouting, or you're across from that one friend for a long period of time indoors, probably with masks off because people are eating and drinking. So that's a very high risk. If you answered eating at a restaurant indoors, that is absolutely number two. So restaurants a little bit better because they tend to be less noisy and tables tend to be more than 6 feet apart from each other. But again, people inherently have masks off, and it's usually for prolonged periods of time. So actually, believe it or not, you're better off at McDonald's where people are going to be eating for like 10 minutes and leaving than you are at a nice restaurant where people might sit at the table for an hour or longer. There's some data looking at spread in restaurants, and it shows when there's kind of a unidirectional flow of air. So, the vent comes out of one part of the restaurant and blows the air continuously in one direction. So whatever table is downwind of potentially somebody who has COVID and is eating at another table is going to be exposed for the whole time that they're sitting there eating. So that maybe that whole hour. If it's 10 minutes, it's better than an hour, but best answer is not indoors. And I can tell you, I have not eaten indoors one time since March. I have eaten outdoors on patios when more than 10 feet apart with my own family on occasion. Sometimes I call ahead to order the food so that I don't have to have the added interaction with the waiter. And I say, pack it up and to go, but we're going to sit on your patio and eat it on paper plates, that kind of a thing, just to be outdoors and getting a change of scenery from eating at home all the time, just kind of a mental health break. But the majority of the time, what we would do is takeout, because that, again, is lowest risk, least exposure to people. Having an outdoor socially distanced dinner with one family is reasonably good because outdoors is great. But the socially distanced part actually is meaningful. A lot of, until recently, people used to say, hey, as long as it's outdoors, don't worry too much about the distance. But there's actually some very new data last week, by the time you're watching this, a couple weeks old, out of Duke, looking at the undergraduates. And the number one area of spread are people who are eating outdoors together, sitting across a table from one another. So do bear that in mind. And if you're going to have a backyard barbecue with some family members who are outside of your immediate household, with a neighbor, with a close friend, again, not a big party, of course, that really shouldn't happen, period. But if you're going to get together with one family, maybe make it a brown bag. You each get your own food or order takeout or something like that. And then just set up 2 tables. Or set up some camping chairs. Keep people 6 to 10 feet away from each other while eating your own food. If you are going to be sharing food, if one person's cooking and sharing, ideally that one person could be wearing a mask while preparing the food, so not coughing or spreading on the food itself, and then not having a single serving utensil that sits in there that everybody's touching the same spoon, but maybe having either things set aside individually or one person who does all the serving, or other ways that not everybody's grabbing that serving utensil. Okay, now here's a new set of activities, and you tell me which you think is the riskiest. One would be camping with members of your own household. 2 is exercising outdoors, whether with or without a mask. 3 is exercising at a gym, with or without a mask. And 4 is staying at a hotel on vacation with your own household. Which of those do you think is the riskiest? And here the answer is exercising at the gym. So when people are huffing and puffing from the exercise, that causes more viral particles to get spread, especially if they aren't wearing a mask, but potentially even to some degree if they are. Again, it's indoors, not a lot of ventilation, and people are at it for a long time, right? Somebody might be exercising on that treadmill for an hour, shedding virus. So this is potentially a more dangerous environment. And I can tell you, I just called to cancel my gym membership. It had been on hold because the gyms were all closed all this time, but now that they're opening back up, I called to say, nope, I will not be coming back to exercise in the gym. That said, outside exercise is wonderful. Whether it is going for a jog, if you're more in shape than I am, or just going for a walk, which is what I typically do, or a bike ride or anything that's outdoors. Again, don't get too panicky about just a quick crossing of paths on a trail. That is not a high risk exposure because it's not prolonged. If people are wearing masks, that's great. If you're more comfortable hiking in an area that's not crazy packed with people without a mask, I think that is totally fine. I wouldn't do it if it's one of those trails that is so crowded that you are constantly beside somebody, because then it's prolonged exposure. But if it's just going to be the occasional every 5 minutes somebody's going the other direction on the trail, that is a-okay. The risk of camping with your own household is 0 because it's your own household that you're already exposed to. And then the risk of staying at a hotel is fairly minimal. The good news is, only one person or one family or one household would have been in that room potentially the night before. And the odds are relatively low that they would have had coronavirus. You can, if you want to decrease the risk even a little bit more, ask to have a room that has been vacant the night before. And because hotels, for the most part, are underused right now, there's often rooms that have been unused. So that's ideal. When you go in, you can use your little Clorox wipes for the light switches and the doorknob handles and anything that's high touch. And then the one other thing you can really do to add a little protection is bring your own pillow. Obviously the sheets and the pillowcases will all be changed, so you don't have to worry about that. But if somebody with coronavirus over the last couple of days had slept on that pillow, certainly the virus would have gone right through the pillowcase and into the pillow itself. And so putting a new pillow piece over it is not really great, but if you bring your own pillow, that is a great way to decrease your risk further. All right. Talking about highest risk activities. So the worst activities are going to be those that are indoor, those that have more than 10 people outside of your own household. You kind of have to acknowledge if you are living with people, you are exposed to them. They don't really count, but you're trying to minimize any exposure beyond people who live in your immediate house. Any unmasked people or longer than 10 minutes. And the more of these factors you put together, the riskier it is. So if you take an event like a wedding, including the one that was recently took place, I believe it was in Vermont, could have been Maine, somewhere very northeast. It was a wedding that had 65 guests, and there was dinner. So obviously they were unmasked and obviously much longer than 10 minutes. And of the 65 guests, I want to say 30 or 40, something like that, wound up contracting it from one individual. And then they went home to their families and to their places of work. And as of the time of this recording, which is mid-October, there were over 175 verified infections from this. And some of those people who attended that wedding were employed at a prison, and another one was employed in a nursing home. And so unfortunately, there have also been 7 deaths, not of any of the direct attendees of the wedding, but of people who they went home to or went to work with. So definitely decline any indoor greater than 10 people unmasked prolonged sort of event. Just like I would suggest avoiding indoor gyms, avoiding indoor religious services, especially if there's any singing. Hopefully that's not currently happening in the state, but if it is not a place that you want to be. If religion is important to you, by all means do anything and everything connecting with people online. Get a prayer group together for a socially distanced outdoor event. There's plenty of ways to continue having religion as an active part of your life that are not being many people together indoors for a prolonged period of time. And then the other thing that's kind of iffy, the more months that we go out, the harder this becomes for people, is haircuts or other personal services. So having your hair done, having your nails done, etc. It is prolonged indoors. Obviously, it's better if everyone's masked, but that doesn't make the risk zero. If you feel like you need to do one of these events, or if you feel like you need to go to the dentist or something else that you're a little bit worried about the risk, one of the best tricks I've heard is get the first appointment in the morning. Okay, so anything that may have been aerosolized or any droplets from the night before, those have all fallen to the ground. And so, you are essentially exposed only to the person who is servicing you at that time. You're not exposed to all of the people who were in that room the day prior. If you go at 2 in the afternoon, however, there's all of the clients and all of the employees for that whole day that you might be potentially exposed to. So first morning appointments can be great. All right, less risky activities. So anything that is done kind of efficiently and socially distanced, I think is not too bad. And I would put grocery shopping on this list. I've given a lot of thought to this. And grocery shopping is usually done in a large building, and nobody really stays in one place for very long. So if you imagine that there is a person in that big grocery store at the same time as you who is sick, and who has kind of a lousy mask and is potentially spreading some viral particles out, you're not going to be near that person for very long. Don't do any shopper stalking. Don't follow right behind some person, 3 feet behind them for the whole time that you're in that grocery store. But if you're in a grocery store for 30 minutes and they're in a grocery store for 30 minutes, you guys are crossing and in different aisles, particles spread very well in large areas. So I actually think that this is a relatively low risk because you're not continuously exposed to somebody, and hopefully everybody is masked. I don't go with friends grocery shopping anymore. I don't go and kind of like check out all the new products and have a lengthy stay of it. I have a list, I go, I get what I need, and I get out, and I try to go as infrequently as possible, once a week maximum, whereas I used to go more often. But I do think that that is an okay activity for you to engage in if you do it safely. And I always bring something that I can use to open the door knobs or the door handles of like a freezer section. Checking the mail has been shown to be not so bad. I know we were all a little concerned at the beginning about the envelopes and the fact that it had been exposed to a bunch of people at the post office and the mail person. I still like to open them all at once, throw out the envelopes, and then wash my hands. And if I have a box that's not urgent, I'm like, might as well wait 2 days before I open it anyway. But this has not been demonstrated to be a source of a spread of infection. You don't need to be Lysoling all of your envelopes. And then, like I mentioned before, walking past somebody on a sidewalk, even if they weren't wearing a mask, not a big cause for concern. As I mentioned before, early morning appointments are probably the way to go if you have to engage in something that you think might be a little on the riskier side. If you can find ways to do some of those activities outdoors instead, if somebody can do your nails or hair or anything outdoors, it's better. But if it can't be done as brief as possible, as infrequently as possible, everybody masked and early in the morning is your best bet. Okay, masks themselves, what to avoid. So there's been more and more data coming out lately looking at how effective different masks are, and the kind of like gator bandana thing turns out to be a no-no. It actually increases to some degree how much particle gets spread. So you don't want to be wearing it, and you don't want to be around people who are using that as their protection. The other one, big one to avoid, is any mask that has a valve for making it easier to expel air. Actually protects the wearer pretty well. It's a one-way valve, so it doesn't let particles in, but it does distribute the exact particles that we're wearing a mask to prevent spreading. So unfortunately, you don't want to be around anybody who's wearing one of those. And as a good citizen of the world, you don't want to wear those valves because you are putting others around you at risk. If that is your favorite mask, and if you feel most protected by it, what you can do is you can put a regular mask on top of it, any kind of 2-layer mask or surgical mask or something like that on the outside of it. And then again, it'll block anything that's being spread. Just wanted to show you some pictures of masks in general. So this N95, as long as it doesn't have a valve, it is very efficient at filtering the large droplets. It even is pretty efficient at filtering what we call those aerosol, teeny tiny droplets that can hang around in the air. It's typically worn in healthcare settings, and I know that most of the messaging out there is don't go buy these because they really should be reserved and preserved for the hospital setting. If you have one, if you feel the need to get one, you have lupus and you're immunosuppressed, and I don't think any of us would hold that against you. But bear in mind that there are other masks that are also very effective, so don't feel like you need to have that. The surgical mask, which is pretty easy to get, is extremely effective for droplets and quite effective for aerosols. Again, you don't need to be 100%. You don't get infected if one virus makes its way into your lungs. You need to have a couple thousand viral particles ultimately to get infected. A hybrid mask is 2 layers of cotton with 1 layer of silk or 1 layer of chiffon. These are kind of homemade types of masks. So the hybrid is actually really effective for both droplets and aerosols, and is a great choice. A regular 2-layer cotton mask is pretty spectacular for large droplets and still helpful in terms of aerosols. So those are good options. And then we start to get to the less and less effective ones. So tea towel, dishcloth, good for droplets, less good for aerosols. Cotton t-shirt, same thing, good for droplets, not doing too much in the aerosol domain. Silk, not doing a whole lot around periods, so I don't recommend that one. The bandana or scarf or neck gaiter, not good. Don't recommend it. Try to avoid being around people with it. And then that mask with a valve, again, not really as good as even that 2-layer cloth, cotton cloth. So why would you invest in the more expensive one, especially since unfortunately it doesn't protect others at all. So you can tell friends if they're using those. Ideally, they can change to something else. Okay, questions. People are asking a lot, what can they do in terms of vitamins or supplements or other things to help minimize the risk of getting COVID or getting severe COVID? The best data is for vitamin D. It's not fantastic data. I cannot tell you that vitamin D is definitely helpful, but if you're looking for something, here's the kind of the best place to think about, because there have been some studies that have shown, one, that patients who are diagnosed with COVID-19 were more likely to have low vitamin D levels. Two, patients with good vitamin D levels were less likely to develop respiratory failure. And three, patients who were given vitamin D were less likely to wind up in the ICU. None of this proves for sure. These are not large randomized controlled trials that demonstrate a definite impact of vitamin D, but vitamin D is low risk. And these are enough things that I think if you're interested in trying something vitamin and supplement wise, this is the one that's most meaningful and most relevant. The other thing to bear in mind is that lupus patients very often have low levels of vitamin D. So probably good for your bone health anyway. If your vitamin D level is low, and you can ask your rheumatologist when it was last checked and what that last level was. If it was truly low and you were called vitamin D deficient, then the way to get your vitamin D levels back up to normal would be one of two things. Either the over-the-counter, and you would take 6,000 IUs or international units per day for about 6 to 8 weeks, or the prescription version is 50,000 IUs, and you would take that once a week, again for 6 to 8 weeks. And those are the two ways to bring your level from low up to normal. And then to maintain it at normal, or if your levels weren't very low, if they were close to normal or roughly normal, maintenance is about 2,000 IUs daily, or the prescription 50,000 once a month. Those are two ways to kind of maintain a good level if you're running a little low or want to really optimize. And vitamin D typically has these clear gel caps that are pictured here below. Okay, what else? The other two that are sort of on the list that are being evaluated are vitamin C and zinc. Not nearly as much in the way of data, but they're both available in a lot of multivitamins. Taking one multivitamin that contains both of these certainly won't hurt, might help. So feel free to try that out as well. Okay, what do you do if you are feeling sick and you develop any of the symptoms on this list that are associated with COVID-19, recognizing you might have COVID-19, or you might have some other virus, or potentially some of these might be a symptom of your lupus? What to do? So the first is call your PCP, your primary care provider, or call the state's COVID-19 hotline. So for North Carolina, the phone number is 866-462-3823. 521, and also contact your rheumatologist. So no matter what, if you have these symptoms, we're going to recommend that you get tested because we know that you're already at higher risk due to your lupus. And we may have additional advice for you. Certainly, if it comes back positive, we may make recommendations about changes in your medication. If you're having any trouble getting the testing, we'll certainly help you out with that. But keep us in the loop, please, so that we can give you and or your doctor advice on how to take good care of you. Okay, a word on vaccines. So what is the purpose of a vaccine? The purpose is to expose your body to some component of the virus, never to the whole functional virus. You can kind of blend up the virus and take parts of the protein or parts of the mRNA or parts of the capsules and show that to your body. So your body sees it and says, ah, virus, and it makes antibodies, and those antibodies would then attack the virus should the whole virus get into your body. So that's the goal. What types of vaccines are out there right now? Well, there's actually quite a few that are in development. So phase 1, there's 26, phase 2, 14, phase 3 down to 10. Now, what on earth do those phases mean? So phase 1 is where they test to see if the medication seems to be safe, like give it to 100 people, and what kind of a dose seems to achieve what they're looking for. So these lots of different vaccines make its way to phase 1. Now you have to do well in phase 1, seem to be safe, not causing any major harm to any people, established a safe dosage to make its way to phase 2. Phase 2 is, well, okay, we looked at 100 people, but like we need to look at a little bit more to make sure it's safe. And then phase 3 is we feel confident that this vaccine is safe. Now we need to see if it's effective. Does it actually prevent people from getting COVID-19? In order to do that test, you need to have tens of thousands of people get vaccinated and see, do they develop COVID-19 over the next 3 to 6 months? So there are 10 vaccines that are entering phase 3. There are 3 of them currently being tested in the United States. There's this Moderna vaccine, there's a Pfizer vaccine, and there's a AstraZeneca vaccine. Duke is doing 2, if not 3 of these vaccine phases 3 studies right now. For the most part, they're looking to enroll healthy patients in this. So typically they would not take a patient with known lupus to involve them in the study. That said, safety's already been fairly established. So if you were approached and wanted to participate in the phase 3 and your lupus had been generally well controlled, I don't think your rheumatologist would object to that. But for the most part, most of us are waiting until things get through phase 3 and then get approval, and that is where you would be offered the vaccine. It would be probably FDA approved at that phase. Now, nothing's made it to that stage yet, because again, it will take months to prove that these vaccines are effective. But those trials are underway right now, and so the hope is maybe by spring we can start to get some of that data. So the next really important question that lupus patients ask, and this is a great question, is, well, when there's a vaccine that's approved, will it be safe for me with lupus? That is a very insightful question. And it's one where we probably won't have a lupus vaccine trial to prove it. That said, I can tell you that so far, no vaccine has been proven to flare lupus or make lupus worse. Okay, it's been looked at, of course, with all of the vaccines that we offer, and most of us are very conscientious about really strongly recommending vaccines to lupus patients. So most lupus patients are getting a good number of vaccines, and we haven't seen any of them flare lupus. Number 2 is that most vaccines so far seem to be equally effective in lupus patients. So can I promise that will be true for the COVID-19 vaccine? Of course I can't. And if you're on a lot of immunosuppression, if you're on high dose steroids and other things, it might blunt your immune system's response. So you might not get as much benefit as somebody not on those medications would get. That said, it's not going to hurt. We don't think it will flare lupus. We don't think it will cause more side effects or more problems in lupus patients. Even if you can get a little immunity, is better than none. And therefore, we do not recommend waiting for a lupus trial. I know some patients who say, I want to see what happens the first year. I recommend to my patients who have lupus, because they're at highest risk, to really try to be first in line for this. When it becomes commercially available, when you do have an opportunity to get access, I recommend it. Certainly all of us in healthcare plan on being kind of on the front lines of getting that too. But if I had a choice between me getting it first or one of my sick lupus patients, I would always want the lupus patient to be first in line for this. Okay, COVIDentify is a study that's being done at Duke. It's actually an international study looking at patients' risk factors. It's looking at heart rate and other things that are visible when you're wearing like a smartwatch. And then it's looking at symptoms and trying to, over huge groups of people, see if they can actually start to identify symptoms of symptoms of COVID-19 earlier than patients are even aware that they have it or get COVID tests. We have teamed up with them to develop COVIDentify Lupus to look at the impact of the pandemic on lupus patients. So what does that look like and how do you enroll? So you can go to covidentify.org to enroll in the COVIDentify study. If you do it that route, make sure when it asks you about your health conditions that you click that you have lupus. And then when it asks you if you're interested in being contacted about future studies, make sure to say yes to that. That gives them permission to send your email address to us so that we can send you the lupus specific surveys. The other way to do it is to email us roomresearch@dm.duke.edu, and then we can send you an enrollment link directly to our study, which will ask you on a weekly basis questions about how the pandemic is impacting your lupus and your life. So the goal really here is to give voice to your experiences as lupus patients. What is it like to deal with the pandemic? What is it like to have to be extra careful about not going out? How does that impact your mental health? Is it harder to get your medications? Is there job loss, which makes it harder to afford medications? What are all of the different ways that this is impacting you? So I just wanted to give you kind of a sense of some of the quotes that we've gotten so far from participants. So one, how has COVID-19 or social distancing impacted your physical health? So we've heard people who say, can't go to the gym, shouldn't go to the gym anymore, worried about exercising outdoor in the sun because sun can flare lupus. And so not being able to exercise, even though knowing that exercise is healthy. Being home all day leading to weight gain. How has COVID-19 or social distancing impacted other aspects of your life? We had a patient who answered that they were really feeling guilty because her kids can't play with friends and have to be more careful than other kids because, of course, she's worried since she has lupus. What if she were to get COVID-19? So making the whole family be extra careful. We had people talk about having less work hours, so less money, losing jobs, therefore losing insurance and not being able to afford medications. Of course, if you're experiencing any of this, please tell your rheumatologist. Most of us have ways of getting you connected with programs to get you access to those medications. How has COVID-19 or social distancing impacted your mental health? And we're hearing all about this. So people who are feeling anxious about the spread, angry about people who aren't following social distancing or wearing masks, people feeling lonely and anxious and depressed, and how it's hard to stay positive when you aren't able to be around the people who bring light to your life. And then other people who are noticing some silver linings, including kind of slowing down the pace of life, spending maybe more time with your nuclear family in your household and having opportunities to potentially enjoy some quality time in that domain. So lots of different people with lots of different experiences. And we'd love to hear from you about how you're doing and how the pandemic is impacting you. In that domain, I wanted to really talk about ways to protect your mental health. I think this is an issue for everybody. I mean, literally everybody, patients, doctors, the whole world. But especially if you have lupus and you're having to be especially careful, having a harder time with all of the different aspects of the pandemic. So what can you do to protect your mental health? Number one, I would suggest exercise, outdoors, taking a walk. It used to be hot. And so I was telling people in the morning or in the evening. And as it gets colder, maybe midday is the right time to do it. But anything you can do outdoors, even if you have to put on a jacket in the dead of winter to just get out there for 10 minutes, it's a really good way to improve your physical and mental health. Outdoor time in general, even if you're not up for exercising, if you're needing to be on the phone, if you can just sit outside for 10 minutes and see real light, it actually, the hormones that it registers through your retina in your eye absolutely improve mental health. Quality family time. So you can view it as we're all stuck together, or you can view it as maybe there's some opportunities to connect. Maybe you start a puzzle night once a week, doing a puzzle with the family, or everybody writes a letter to a relative, or movie night, or anything that brings people together. And then finding other ways, maybe through technology, to connect safely with friends. So if you can't go and eat lunch with your friends anymore, maybe it's an opportunity to find another way to connect. Phone calls that maybe we've gotten less good at over the recent years. And I've heard a number of cool stories about people who have reconnected with high school friends. And now every Friday night, they're having a Zoom session with people they haven't been connected with maybe in a decade or longer. So this is a fun way. Everybody's in the same boat, right? Remember that other people are kind of desperate for these social connections too. So there's great opportunity there. And then if you've never tried it before, I recommend giving a try to meditation. There are some fun free apps that are available. Headspace and Calm are two of them, and they'll kind of walk you through it. They assume no prior knowledge. You don't have to have ever done any meditation in the past to be able to connect through these. And then finally, of course, please, I hope it goes without saying that if you are struggling, please be in touch with your healthcare providers about that. We certainly can connect you with professional help. And again, if we have to look for silver linings, one of them is that psychologists and therapists now are offering a lot of virtual sessions. So it may actually be easier to access some mental health care potentially now than it was before. Out of the comfort of your own home, out of the safety of your own home, to let us know how we can connect you with the help that you need. All right, with that, I just want to review a couple of take-home points. So one is, yes, I will acknowledge that lupus patients are at higher risk than the average person. It's therefore important that you take precautions, and certainly reasonable that you're asking those who you are exposed to in your house or people at work that you are going to be in close contact with, that they're also taking precautions. If you need a letter from your rheumatologist, we're always happy to write those, sort of saying, yes, masks should be mandatory for your colleagues at work, or something along those lines. Life can't be lived in a literal bubble, and you want to find safe ways to connect, right? So maybe that is that you have that one friend who you know is being pretty good, and you have her over for dinner in the backyard 6 feet away from each other, okay? Or you take a walk with a friend and you're both wearing masks. Other things that you maybe can try to find that are low risk. What I find people are doing sometimes is they're doing the no risk, bubble, 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 and then, okay, what the heck, it's the 4th of July, let's get together with everybody for a big 50-person family reunion barbecue. And that is higher risk than actually, going to the grocery store once a week and having 6 feet away dinner with one friend every couple of weeks. I would rather you do things that are low risk on a regular basis for mental health than make yourself miserable for months and then suddenly go to a super spreader event. So make sure that the people who you are choosing to interact with are taking good precautions. And then remember that just generally things that are good for your health are also good for your immune system. So getting effective sleep, eating well, lowering your stress levels, all of these things will maximize your immune system to hopefully prevent you from getting sick. Remember that most medications don't change your risk of COVID-19, so you definitely want to stay on your lupus medications. And if you're on high-dose prednisone, talk to your rheumatologist about ways to see if you can potentially get down on that medication sooner rather than later, but not abruptly. And then keeping your lupus under good control will help prevent COVID-19. So this is not a time to stop medications. This is not a time to slack off on appointments, because if you have a lupus flare, a significant lupus flare will require steroids. And we know that that is the one thing that's truly dangerous. So definitely a good time to stay on top of things and try to keep lupus under good control. With that, I'll just say that if you do have questions or concerns, please reach out to your rheumatologist. We want to be here for you. I think we've heard many questions many times at this point, so we're actually reasonably practiced, have thought through our answers, and hopefully have something at the ready that will be helpful for you. I hope you've enjoyed this. I wish you all a wonderful rest of the summit, and rest and safe a safe rest of the 2020 and into 2021. Take care, everybody. Thank you.